welcome. Thank you for watching this video. This is Nurse Choma, founder of Choosing Nursing. Today we're going to be talking about how to think critically for the Nclex exam. So if this is something that you feel like you're struggling in, yesterday we talked a little bit about why it's so important, then you definitely want to watch this video all the way until the very end. And go ahead and hit the follow button right now if you're not already following me. I promise you I give you great information. And to learn more about us or to learn more about myself, simply go to our website, choosingnursing.net. All right, so come on in, comment below, say hello. Sorry for being a few minutes late. I was having some slight technical difficulties, but we're good now. So go ahead and come on in, share the video, like the video, heart up the video. It's going to be a great morning today. I'm excited that you're here. Hello, welcome. Thank you for being here. Comment below. Let me know where you're watching the video from today. If you're watching from New Orleans, Atlanta, Georgia, New York, wherever it is, hello. Let me know where you're tuning in from, whatever country you're watching from today. All right, I would love to hear from you. And I want to also share with you that we have something very exciting, really major. That is happening starting next Sunday. All right, somebody say next Sunday. All right, starting next Sunday, and this is going to be a really phenomenal. I'm so excited about this, and I cannot wait for this experience. I know it's going to be amazing. So welcome from Dallas, Texas. Hello from New York. Welcome from New York. Good morning from Nepal. Good to see you here. Welcome from New Mexico. It's cold. Welcome from Arlington, Texas. Good morning. Hello. All right. Yay. Thank you for joining with me this morning. So yeah, so what we're starting next Sunday is we're having our New Year, New License Challenge. And this is something that we don't do it all the time, just specific time periods of the year. And this is an amazing challenge because it's not going to be like anything that you've ever experienced before. What we're going to do, we're doing live stream videos on here. So I'm going to come up live and do very specific, concentrated, really in-depth teachings with you. And then we're going to do this for 5 days. In addition to that, we're also going to be sending you out like notes, things you need to know about things about the challenge, like updates about every day. So it's really important that you pay close attention to the emails, all right, because we're going to be sending you out important email updates every single day of the challenge. In addition to that as well, we're going to be doing special giveaways as well, special giveaway prizes as well for those who participate. So this is going to be really exciting, and we've added a couple of things that we're going to do for this challenge that we didn't do for the last one. All right, so you definitely want to be a part of it. We definitely want to be a part of the challenge. It's going to be a really exciting experience. If you already signed up, comment below and let me know that you already signed up. I want to welcome you and everything. If you would like to sign up, and if you have not yet signed up, all right, you have to sign up even if you're already on the email list. Otherwise you won't get all the notifications. So to sign up, simply type the word in Nclex. All right, Nclex, one word, Nclex. And then once you type the word Nclex, we'll send you the link through your messenger box, so you can through your Facebook messenger box, so you can sign up that way. If you don't have the Facebook Messenger, then you want to go to the link I'm posting right now, bit.ly/choosing nursing challenge. Let me put it in the comments really quickly. All right. Oh, thank you so much. Thank you. bit.ly/choosing nursing challenge. All right, that's the link right there to join if you don't have Messenger. If not, just type the word Nclex in the comments. All right, so share this video, comment below, let me know you're ready. Also like up the video, heart up the video, so I know you're enjoying the content. And if you are ready, type the word ready in the comments. All right, type the word ready in the comments. and we're gonna get started today. All right, this is a subject that I really enjoy teaching about. Thank you so much. You like my earrings? Thank you so much. All right, so go and comment below and let me know you're ready today. Let me know you're ready. Hello? Ready, ready, ready? All right. Okay. Okay, good. Okay, I see some readies. Awesome. Okay, good. So I'm going to talk to you today about 4 main ways to think critically when it comes to the Nclex exam. All right, 4 main ways to think critically when it comes to this test. And this is a portion of being prepared. This is not all of it, right? Because you got to actually know the content too. But this is a very strong portion, and a lot of times the reason why you may have challenges passing the exam is because you're going through the content, but you're not grasping the critical thinking portion. So this is why it's such a priority, and this is an area that a lot of people struggle with, because a lot of people tell me, well, how do I think critically? I don't know how to do that. Can you explain it to me? All right, thank you for sharing the video. Okay, so let's go over each of them. Number 1, let me talk about the first one. And if you put number 1 in the chat box, put 1 in the chat box. All right, we're gonna go over the very first one. Okay, so the first one is that, so a lot of times when people are, okay, first let me first give the main point. All right, let me first give the main point before I give the 4 of them. When it comes to preparing for the test, critical thinking, it should be when you start studying, not when you're doing practice questions. One more time. When it comes to preparing for the exam, critical thinking should begin when you start studying the content, not when you start doing questions. So a lot of times a lot of times we get into the habit or the repetition or the routine of, reviewing books and listening to the teachers and that kind of stuff, but we don't really engage in thinking more critically. It's just like a pattern of just trying to memorize the information, but it's not really challenging us in our thinking more critically. And then it's not really until we do questions when we think more critically. But the thing about it is that you have to begin your critical thinking at the beginning when you're learning any type of content. All right. Oh, I just remembered something else I want to put right now. Let me add this right now. Okay. All right. So it has to begin. So this is the main point. This is not number 1 yet, actually. This is just the main point. Critical thinking, it should begin when you're reviewing content. Don't wait till you're answering the questions, because then you're going to miss the gap between the two. All right, so here's number 1. You need to identify the process. Okay? You need to, and thank you so much for writing this in the comments too, though. You need to identify the process. A lot of times when people are learning the information, what you're doing, you're learning the signs and symptoms, the risk factors, the treatment, all that kind of stuff, but there's no correlation with the process. So the thing about the test, with the way that the questions are, how are the questions? It's gonna be, what do you do first? What will the nurse do next? What would be the greatest priority for the nurse to do? That type of stuff, right? So that's all the more reason why you need to identify the process when you're learning any type of content. Let me give you an example. You identify what would lead to this point. What would lead to this point? What would cause somebody to get to where they are right now, and how would they recover? This is how you take the information, right, and personalize it to a real person. Because the exam is not testing you on what does Mr. CHF do. The exam is not testing you on what does Mrs. Hypertension do, right? No, it's testing you on what Mrs. Smith does that has hypertension. right? How you should respond because Mrs. Smith has hypertension. It's testing you on real life scenarios. One of the challenges a lot of people have is that they don't know how to take the information and apply it to the test. And that's only because they have not been looking at the content as real life scenarios. So, for example, instead of me seeing angina as just angina, okay, what led to what would happen that would cause them to come to the hospital, right? So probably they were having so much angina that was uncomfortable and they decided to come to the hospital, right? Maybe they were having, and so while they were at home, they were probably having the angina maybe when they were resting, maybe when they go up and down the stairs, which tells us the type of angina that it is, if it's unstable, if it's stable, right? So all this is helping me to identify the process, right? And so then when they start having the chest pain, they probably took some aspirin at home, which is probably the reason why their platelet count is so low, is because their blood is so thin because they've been treating it on their own by taking so much aspirin. All right, and so then now they're in the hospital and now we discover that they have a real heart attack. That's me looking at the process. All right, that's me identifying the process of the content, not just looking, okay, what are the signs and symptoms, what are the risk factors, but really though, thinking of this like a person. Why did they come to the hospital, right? What would lead them to have the signs and symptoms, the risk factors, right? And then once they have those risk factors, that will lead to the signs and symptoms. And then once they have the signs and symptoms, what will we do to treat those signs and symptoms? And then once we treat it, how do we determine what to do so that way they don't get worse, right? So they can recover. So the first thing is that you got to look at the process. Look for the process in everything, right? Even when you're learning, even when you're learning, for example, like Foley catheters, you know, that's a really good example where it's showing you the process of putting a Foley in. It's not just what is a Foley, what does the Foley do, what's the output. No, but the reason why they need a Foley, maybe it's because they're on Lasix, so we need to monitor their urine more strictly, right? The reason why they have the Foley is that maybe because they have urinary retention, and we need to just make sure that they're peeing, right? So whenever you look at the information, think about the process. Think of it as a person. Imagine if somebody that you knew had this disorder, why would they come to the hospital? That will help you to remember it better. Okay? That's the first one. Number 2, pay attention to differentiating factors. One more time. And this is going to help you a lot with SATA questions. Let me say this right now. The second tip that I'm going to share with you right now is going to help you a lot when it comes to select all apply questions. Okay? So pay attention to differentiating factors. What do I mean by this? A lot of times when we review content, we learn the content, right? But we don't pay attention to how this is different from this. And that's why when we see it, for example, in the form of a SATA question, we'll get confused, right? But if you first identified how it's different at the beginning, you won't be as confused. So let me give you an example, okay? Because a lot of times with SATA questions, the questions are, oh, what are the signs and symptoms of this diagnosis? And it's like 6 choices, right? And you have to pick however many it is. And so oftentimes they're going to mix in symptoms of the opposite then. But if you didn't pay attention to that earlier, you'll confuse it. So let me give you an example. Hypothyroidism versus hyperthyroidism. All right. So it's a thyroid problem, right? For both of them, they have a thyroid dysfunction. But the biggest difference between hypo and hyper is that with hyper, everything goes up. But with hypo, everything goes down. All right? So with hyperthyroidism, the blood pressure goes up, the heart rate goes up, you know, and when I'm thinking about everything going up, I'm thinking of it based on by system, you know. So because everything goes up, the GI motility is increased, so they usually have more diarrhea. Everything goes up. Their heart rate's up. They have tachycardia. Their blood pressure goes up, right? Everything goes up. But hypothyroidism, everything goes down. All right, so usually instead, they're more tired, they're fatigued, they have lower blood pressure, they have a lower heart rate. They tend to have like brittle nails, right? Because they're not producing enough like hormones. So everything goes down with hypo versus hyper, right? They both involve the thyroid hormone, but the differentiating factor is what goes up and what goes down. Septic shock versus hypovolemic shock. Both of them are shock, meaning that the patient tends to have low blood pressure, right, and high heart rate. But the biggest difference between hypovolemic shock and septic shock is that hypovolemic is about blood volume, but septic shock is because of a bacteria. So with hypovolemic shock, they're in shock because they lost a lot of fluids. With septic shock, they're in shock because they have some type of pathogen or bacteria. And so the best way to treat septic shock is going to be more so treating the bacteria. But the best way to treat hypovolemic shock is going to be more so giving them fluids or blood. See how they're similar, but they're different. So when you're reviewing the content, it's really important that you don't just memorize what something is, but look to see how it's different. Okay, you know what? Like, for example, I remember I was like, if you're reading, let's say you're studying myasthenia gravis and Guillain-Barré syndrome. If you really look at the signs and symptoms, myasthenia gravis and Guillain-Barré are very similar, in the sense that they're both autoimmune disorders. They're both pretty much something where it's a progressive diagnosis. So meaning that they have progressive muscular weakness, right? Both of them. And they're not something that can be curable. It's only managed. But one of the biggest difference between Guillain-Barré and between myasthenia gravis is what triggers it. Guillain-Barré can be triggered by either respiratory infections or from immunizations. Similar symptoms, but different causing factors. And that's what the exam is going to test you on, to see if you understand the difference. Is there any sense? Yeah, that's the example right now. With Guillain-Barré and myasthenia gravis, they have the same signs and symptoms, but they have a different cause. Because what the thing about on the test is that when you see questions, the questions are going to they're going to include different factors in the question. But you can't, Happy New Year, you can't just pay attention only to the signs and symptoms. You have to look at the whole picture. Otherwise, you're going to misdiagnose whatever the diagnosis is. All right? So that's number 2. Pay attention to differentiating factors. Okay? Pay attention to differentiating factors. All right? Is this making sense? Is this good? All right, thank you for the hearts. Thank you so much for the hearts. And thank you for sharing the video. If you find this information helpful, share this video or tag somebody. Let somebody know about this information. That way they can at least watch it later. All right? Okay. So here's the third one. Here's number 3. All right, if you're just tuning in, thank you for watching the video. Thank you for being here. My name is Nurse Choma, and we're talking today about how to think critically. all right, for when it comes to for the sake of the exam. How to think critically, all right? Okay, so here's the third one, all right? Oh, and then also if you want to join, thank you, I'm glad it's helping you. If you haven't already, we are getting ready to kick off our new year, new license challenge. Oh my, I'm so excited about this challenge. You guys have this challenge is going to be better than the last one because there's some things that I'm adding to this one that's not going to be the same as the last one. All right, it's going to be more. All right, I'm going to also include homework and then like some bonus guides as well as part of the challenge. So if you have not already joined the challenge, you got to join the challenge even if you're on the email list, because we're going to give out different stuff to people in the challenge. All right. Oh, good. Okay, good. In April, good. So type the word Nclex. Type the word Nclex in the comments if you have not yet joined the challenge, and we'll send you the link to join the challenge. Okay, here's number three. Number three. Look for the bigger picture, not for the symptoms. All right. This kind of goes into the third one. Look for the bigger picture, not for the symptoms. So a lot of times what people do is that they only pay attention to the symptoms. All right, good. I'm glad you're ready for it. People pay attention to the symptoms, but not the bigger picture. All right, so let me give you an example because, and I'm going to show you why it's so important. I'm going to show you why it's so important. There's a question that there's an Nclex question that I'll often ask to a group of students that I'm teaching. And a lot of times, everybody gets the question wrong. All right, usually the question will say something about, it will say, okay, you have a patient, they're confused, they're having seizures, their sodium level is 179, they have poor skin turgor, and then the question will say, which of the following interventions should the nurse do next, or should the nurse do? All right. So it says, so they have poor skin turgor, they're confused, they're having seizures, sodium is 179, and their heart rate is 111. All right. So the choices are, okay, monitor their calcium, monitor their sodium, monitor the potassium, give them fluids. I'm trying to think what was another one. Give them Cardiazam IV, and then tell the patient to do bowel maneuvers. All right. So a lot of times people will pick almost all the choices. They'll pick, okay, yeah, give them fluids. They'll say monitor the calcium, give them the Cardiazam, tell them to do the bowel maneuvers. So they usually pick about out of 4 out of 6 of the choices. All right. So here's the thing, though. When people choose the answers, they're choosing the answers because they're matching the symptoms. Let me say that one more time. I've noticed a pattern that a lot of times people choose the answer because they're trying to match the symptoms with the answer choices. But if you do that, you're going to get it wrong. Because you have to think, what is the picture of this? What's the bigger picture? Pretty much, what's the diagnosis? So with that type of situation, the patient is developing hypernatremia. It's hypernatremia that they have. So you have to identify what's the treatment for hypernatremia. And the treatment for hypernatremia is just give fluids and monitor the sodium. It's not all the choices. But people will put, they'll say, check the potassium. Give them Cardiazam IV because the heart rate is high. Tell them to bear down. No. You have to treat the diagnosis, not the symptoms. You see that? You got to treat the diagnosis, not the symptoms. If you treat the symptoms, you're always going to miss it. But if you treat the diagnosis, you're going to be on point. Okay? So the biggest thing is that you got to look for the bigger picture. It takes people some time to get this part. I noticed it takes people some time to really understand this part. But you have to look for the bigger picture. not the symptoms. Otherwise, you're going to always pick the answer based on the symptoms, not based on what was really happening. Okay? All right, good. Okay? And here's what I recommend. To get stronger, I'm glad you got it right. To get stronger in this area, I usually tell people create flashcards. You got to create flashcards. One side of the card, you're going to put down the diagnosis. The other side of the card, you're going to put down whatever it is, like the signs and symptoms, the risk factors, the treatment. That way you can train your mind to recognize a diagnosis without seeing everything. Because that's how the Nclex is. The Nclex is not giving you everything. It wants to see if you know the missing piece. And if you know what to do because you know the missing piece. You see that? So that's why I tell people to create questions. Now, one thing I actually do have like a guide or flashcards. I do have a guide where I go over like disease processes, pharmacology table. It also includes as well like rules of nines, like burn patients, restraints, therapeutic communication, maternal health, and then so it's like a guide. It's my 70 diseases cheat sheet guide. It's about 43 pages long. And I also have a farm guide, which I go over like farm medications, classifications, formulas, how to do dosage calculations, how to mix insulin, just different things you need to know about pharmacology. And that's going to be about 46 pages long. And then I have another teaching, which is about labs. It's Labs 101. And in there, I'm glad you love the guides, Mary. In there, I go over labs, like what you need to know about potassium, what you need to know about white blood cell count, that kind of stuff, so that way you have a better understanding. If you want to get it's a full bundle. It's called the Nclex cheat sheet bundle. If you want to get that, simply go to the link that I posted here in the comments. All right, and it's only $39. It's 70. So what it is 70 diseases and conditions. So it also includes like chemical restraints. It also talks about different type of mental problems. So, and then also ABGs, how to calculate ABGs. So it's the things that are the most frequently tested on the exam. All right, the things that are the most frequently tested on the exam: pneumonia, standard precautions, that kind of stuff. Okay, so let me keep going. Here's the last one, number four. Choose answers based on pathophysiology. And thank you for hearting the video, you guys. I appreciate your support and for sharing this. Choose answer based on the pathophysiology. All right? Choose answer based on the pathophysiology. So this part is where a lot of people struggle with the most. Because so the thing about the Nclex, when it comes to questions, the patho is linked to the answer. Put that in the chat box. The patho is linked to the answer. One more time. The patho is linked to the answer. Right in the chat box, so I know you get it. The patho, all right, is linked to the answer, and that's why you gotta know the patho first. If you find yourself if you're struggling to retain the information, or if you find yourself taking the exam and you get a lot of below passing categories, then your issue may be the patho. All right, the patho is literally, it links you to the answer. Let me give you an example of that. You know how sometimes the question it will say, okay, what do you do first? What should you do next? If, let's say the question says that the patient has had an MI, I'm just going to use that again. They had a myocardial infarction, and the choices are, you have different choices. Maybe the choices are, let's say they already received aspirin, okay? And so the patient, it says that they just had an MI. Which of the following are you going to do first? All right, are you going to give them oxygen? Are you going to, what's the other word I'm looking for? Are you going to give them oxygen? Are you going to get the EKGs? Are you going to draw their blood? Or are you going to ask them if they are having pain? Okay, so what happens when somebody has a heart attack? What's the pathophysiology? In fact, let me see if you can tell me really quickly in the chat box. Oh, you did? Okay, Lilo, it's okay. Just email us. Just email us, and we'll add you again. Just email us or go to the what's the word I'm looking for? Message us here in the Facebook page, and then we'll check what email it is for you, and we'll make sure you get access to it again. Yeah, just go to just message us and tell us your name and everything, and then one of the customer support will do that, and we'll send it to you. Okay, so I see pain. Okay. All right, pain. Hey, good to see you, Keisha. Okay, pain. Okay. All right, here's the thing. What's the patho though of an MI? The patient, so the patho of an MI is pretty much where there is a sudden occlusion of blood flow. There's a sudden occlusion of blood flow in the heart, in the arteries in the heart. And because of the sudden occlusion of the arteries in the heart, and remember, blood, that blood that flows, it carries oxygen. It carries oxygen. So because there's a sudden occlusion of the blood flow, they're losing oxygen. So for that reason, it's going to be a priority to give them the oxygen first. Not that you don't do the other stuff. You do the other stuff. But the bigger priority though is to give the oxygen though. All right. So here's the thing. The great thing about when you're learning something on the test, because oftentimes if you treat the patho, you treat the other symptoms. I'm telling you, if you treat the patho, you treat the other symptoms. That's why, like I said, we want to focus on what's the pathophysiology, because that tells us what to do. So what was it? I forgot. Somebody asked a question. Oh, yeah. So if you treat the patho, it treats the symptoms. Okay. So oxygen will be a greater priority. MONA is true. You do morphine, oxygen, nitro, aspirin. But the thing about it is that when it comes to the exam, you need to know what you do first, though, based on the context. You got to know what you do first, because the exam is not going to test you based on what it is, but it's going to test you based on what you do first. What is the priority based on the context? You see that? So this is one of the things when it comes to the test. Does that make sense? Really quickly in the comments. Let me know if that makes sense. If you follow what I just said right now. You got it? Okay, good. So a lot of times the patho, it's the answer is linked to the patho. All right? That's why it's so important that you know the patho. That's why it's so important. Because if you confuse the pathophysiology, then you're going to mix it with other choices. All right. I notice a pattern, and one thing I've noticed is that sometimes when people are studying for the test, they are studying and because they're consuming, because the goal is your focus is, okay, let me try and learn as much as possible. Right? I want to learn as much as possible. But then the problem that happens is that you begin to mix stuff up and merge stuff up because you're not sure what's most important. That's the issue with learning everything, is that you don't know what's most important. One thing I tell people is that start first, do it in this order. Figure out what you're weak in, then work on improving those areas, and start with what is most important. Start with what is most frequently seen on the test, and then start learning random stuff. Okay, then start learning like really random, like what's this enzyme for this rare condition, you know. But start first though That's how you make your studying a lot more target and on point. Okay? All right. Was that good? Was that good today? Let me know if that was good. Let me know if that was good. If you found that helpful, comment below what I just said right now. I think I'll say I'm gonna share one more thing and I'll be done for today. This is a bonus tip. This is a bonus tip. Here's the last thing. What would the Nclex want me to know? All right. This is the last one. What, as far as thinking critically, what would the Nclex want me to know? Number four was choose answers based on patho. So they were identify the process, pay attention to differentiating factors, look for the bigger picture, not the symptoms. And then 4 is choose answers based on the patho. Yeah, I'll leave this video up. All right. The bonus is, what would the Nclex want me to know? What would the Nclex want me to know? All right. You can go to the link if you want to get the bundle. You can go to the bundle. Get the bundle. It's $39. If you want to get the bundle, it includes the guides, and then also the bonus, and also the labs teachings as well. All right. Okay. So, what would the Nclex want me to know? That's the very last thing. Happy New Year to you too. What would the Nclex want me to know? What would the Nclex want me to know? Here's what I'll do. If you missed the promotion, the promotion that we had for the bundle, use the code again. But we had a promotion. It's not gonna be the same price. What I'll do, we'll add a special promotion if you missed the one that we had yesterday or the last 2 days, and it'll be $29 instead. That's what I'll do. All right. So use the same code, New Year. In fact, let me put it on here really fast so that way you don't miss it later. All right. And I'll just tell them to do that for you. Okay, so it will be, if you missed the last promotion, but this one will be $29 instead. Just use the same code, New Year. Okay. All right. So yeah, that was the last thing I wanted to say. Is what would the Nclex want me to know? That's what we're gonna cover in the challenge. All right. In the challenge, we're gonna cover what the Nclex would want you to know. That's what we're going to cover. All right. So join the challenge. If you have not already, join the challenge. It's free. It's going to be for 5 days. It's going to be really jam-packed. And I have homework, and I'm going to also be sending out like handouts and lesson plans. It's going to be really good. So join this challenge. You can just type the word Nclex if you have not already joined. Any advice for a first semester nursing student? I would say don't give up. Don't give up. Stay focused, and don't be concerned about having a social life. Okay, that's what I would say. Yeah, it is. You, Happy New Year to you too. The challenge starts on Sunday. The challenge is starting on Sunday. Okay, the challenge is starting on Sunday. Okay, it's gonna be downloadable. It's just downloadable. All right, it's going to be downloadable. All right, so the challenge is starting on Sunday at this same time, 9 a.m. Eastern time, and I'm going to email you. If you already joined the challenge, we're going to send you something out either today or tomorrow. But join the challenge now, and then we're going to be sending out some handouts. So tomorrow when I come up live, I'm going to show you what the handouts look like, okay? So you can see them. But it's all going to be downloadable. All right, so see you tomorrow, same time. And at this time, if you want to join me tomorrow at 9 a.m. Eastern time, and we're gonna also go over the challenge tomorrow, and also I'll do another topic as well. All right, you guys. If you have any questions, inbox me right here on the Facebook page. To join the challenge, type the word Nclex. All right. Okay, then you're good, Emem. To join the challenge, type the word Nclex, or go to bit.ly/choosing nursing challenge. All right, bit.ly/choosing nursing challenge. If you just scroll up, it's on the banner. Like we create a huge banner, and it says the link to join the challenge. All right, have a wonderful day. I'll see you tomorrow.